Bismillahirrahmanirrahim. Rabbi Zidni Ilma. You have to keep breaking your heart until it opens, by Rumi. Assalamu alaikum everyone. My name is Dr. Sadia Rafiq and under the supervision of Professor Dr. Saira Afzal. Today my topic of presentation is planning cycle with reference of District Health Planning Manual. Learning outline. Introduction of planning cycle, steps of planning cycle, detailed description of each step, recent updates, and multiple choice questions. Learning outcome. At the end of presentation, participants would be able to describe planning cycle and its 11 steps in detail. Introduction. The planning cycle is a systematic process which enables managers, providers to determine how resources are used in relation to achieving their goals and objectives. It consists of a series of 11 steps. The first 6 steps are sequential and their position should not be changed. The last 5 steps can be changed according to the needs of the existing situation. Step 1 is the planning of the planning. 2, review of policy guidelines, then situational analysis, review of resource availability, development of interventions, setting plan objectives and targets. 7th is determination of resource requirements, adjustment the management organization system, then the preparing the budget, developing the plan of operations, and last but not the least, planning for monitoring and evaluation. So this is the whole planning cycle, and now we will discuss each step one by one. Number 1, planning the planning. Its stage deals with prerequisites that have to be in place and issues that have to be resolved before the actual planning exercise may start. Objective. The objective of this is to ensure that the planning process can be carried out smoothly. Before planning can start, the planners need to establish and identify the position of the planning body, which is District Health Management Team, DHMT. DHMT is an administrative body for all health matters in a district. It is not an elected body, but is constituted by the EDO Health or DHO, District Health Officer. The DHMT has a core and extended team. The core component comprises members working within the district health offices, while the extended component includes all other members of DHMT. The planning body includes a district health officer or executive district health officer, chairperson, medical superintendent, in charge district health development center, assistant deputy district health officers of Tehsil, district coordination, then district coordinating HMIS, in charge MCHRS services, district population welfare officer, representatives of town or municipal committee, representatives of NGOs, representatives of district medical association, elected representative of the community and the respectable of the communities. DHMT has been established in several districts of the country, especially those being provided assistance by the Multi-Donor Support Unit and or the World Health Project. The DHMT has yet to become established in the majority of the country's districts. The early experience of established DHMT in several districts has been encouraging. The Multi-Donor Support Unit has developed guidelines for the establishment and operationalization of the DHMTs. Role. Their role is to determine specific terms of references, TORs of the plan, including objectives, purposes, target group, and time period of the plan. Identify resources available for timing, tasks, and responsibilities of the planning exercise. The third is assign specific tasks and responsibilities to each member of the planning body. And fourth is evaluating the planning process and prepared plan. Step 2, review of policy guidelines. Review of policy guidelines is a process of familiarization with government directives and conditions that prevail and must be followed in the preparation of district plans. And the purpose is in such review is to ensure that the district plan is in line with the national or provisional policy guidelines. So despite establishment of devolved governments, at the district planners need to review national and provisional guidelines and review provisional programs. Review of policy guidelines. Provisional guidelines translated into district plans in the priority areas of reproductive health. For example, the district reproductive health package approved with the consensus of Federal Ministry of Health and Ministry of Population Welfare and endorsed by in provisional governments in 1999. The 9 components of reproductive health package identified with 4 priority areas was the same: motherhood, family planning, STIs, and infant health. Other reproductive health programs of women, adolescents, male, then the detection of breast and cervical cancer and infertility. Current and new public sector programs and district plans/activities are being developed in line with priority areas identified. like National Program for Family Planning and Primary Health Care, Family Planning Program, regular MCS services of the government, Women Health Project, and the Reproductive Health Project in the pipelines. Third step is the situational analysis. The situational analysis is the process of analyzing and interpreting all information available from various sources on the current situation of the health system as it prevails within the specific geographic area under consideration. Purpose. Specific purpose of the situational analysis are to identify health problems and health services needs arising as a result of these problems, to determine causes and circumstances underlying problems in the health situation as well as with the delivery of health services. Next, to assess availability and adequacy of resources in the light of health service need. And last, that to identify gaps and weaknesses in the healthcare services in line with the health problems and service needs. Parts of the situational analysis. These are descriptive and analytic. The descriptive part describes the situation as it is at present. This helps in assessing the magnitude of the problem, which in turn help in prioritizing the problems. The analytical part deals with the factors that determine the existing situation and is used subsequently for developing appropriate interventions. Situational analysis of contraceptive used by eligible couples. Like descriptive component would be contraceptive prevalence rate for all and for modern methods, types of contraceptives used by couples and unmet needs for contraceptive. And the analytic component would be address the knowledge about contraceptives among men and women, decision making about use of contraceptives, contraceptive use by location, education, socioeconomic status, etc., and then the available sources of contraceptives and their cost. So the sources of information for situation analysis include the vital statistics, census, health information system, hospital records, health system review, also called health system analysis, special surveys in the field, and qualitative method for data collection. Components of the situational analysis. It is useful to consider a situational analysis under the following 4 components, as later it may be helped by preparing a situational analysis report. A, determine existing problem, then the prioritize problem, ascertain available resources for addressing existing problem, and identify weaknesses and strength of the existing system. So first is determine existing problem, description of the background of the initial problem and the indicators of the health status. These the indicators are the primary indicators of the health status are objective statistical indicators associated with tangible physical measure. These are the ones usually employed and available from professional health workers, physicians, epidemiologists, biostatisticians, and demographers. The secondary indicators of the health status are those which tend to be associated with or are causally related to the primary indicators, are less easily to quantify and do not give a good indication of the status of the health. And the summary indicator and measures of the health status are an attempt to capture the morbidity, disability, and mortality in one composite indicator. These are now being used more frequently in the literature. Giving the example of the primary indicator of the health status, primary indicators are derived from the natural sequence of life, that is birth, illness, disability, invalidity, and death. The number of events for each of the above are not primary indicators per se, but when used as numerator or denominator, as the case may be, will assist the development of primary indicators of the health. Like birth, crude birth rate is the number of live births during the year, and / average median population multiplier. Example, according to 1998 district census report, the population of district Bhagalpur was 2.43 billion. The total number of live births during previous 12 months was 56,534. The CBR would then be 23 per 1,000 population. This may well be an underestimate, as in poor patients such as Pakistan, infants who die shortly after birth frequently are neither registered of having been born nor subsequently of having died. Secondary indicators of the health status. These are different sectors and these are the indicators. Like sectors are the demographic, and we go for the indicators are the age distribution of the population, population growth, population density, urban rural distribution. Then the socioeconomic includes the GNP per capita, human development index, sorry, per capita calorie and protein consumption, then the political, then the cultural and traditional, and healthcare delivery system. In this, the indicators are facility to population ratio, physician to population ratio, nurse, paramedic to physician and population ratio, bed to population ratios, and the percentage of the population within 5 kilometers of the health facilities. It is just an example, again, health problems among vulnerable population segment and the general population in the hypothetical districts of 10 lakh population. In this, we have the age groups first, then the preschool children, 16% of the population, the women of 15 to 49 years, 20% of the population, and then the general population. Then we see in each specific group the health problems, like in children high infant mortality rate, under 5 mortality rate, diarrhea, disease, acute respiratory, then the best estimate of their how many episodes and how many cases occur in a year per thousand, and the estimated number of the affected individuals. So it is done like this. Second is the problem prioritization, ranking of health need and problem priorities. Important criteria for ranking health and nutrition problems include the magnitude of the problem, the severity and danger, the vulnerability to intervention, cost, effectiveness, and the political expediency. Problem prioritization by planning team for district during a planning workshop includes that it is the health problems, then the magnitude, severity. So if we see the acute respiratory infections and diarrheal disease under 5 children, the magnitude shows the 4 pluses, severity, vulnerability to intervention, cost effectiveness, and political expediency, and total score is 15. So we have the health problems and then we prioritize according to it. The scoring categories from a scale of single plus to 4 plus, and the total score you can see by this we can prioritize the very well the problems. So the matching problem priorities which causes a symptom, the problem tree. Once health problem priorities have been identified, their underlying causes as well as their consequences for overall development needs to be examined. For this purpose, a problem tree is to be developed for each of the health problem priorities. It is shown in the problem tree showing consequences of high maternal mortality. You can see it's a high maternal mortality. And these are the different causes which are leading to high maternal mortality. And the problem tree is there is economic loss, there is social problem, and there's poorer childhood because of this reason. I'm a little bit fast because my presentation, I have to cover all the things in it. The next is identifying health and service needs. The problem tree is being reversed to provide a list of health needs objectives that would have to be achieved with the health plans needs tree. To what extent are services and inputs in place addressing the main, central, as well as underlying the problem? You can see this is the problem tree, and now we have to manage it according to the need tree. In the need tree, if there is low maternal mortality, if we improve all those causes which lead to the maternal mortality, if we lower them, there will be less economic loss, there will be less social problems, and there will be improved child health. Assessment of health service programs, input program. The planning team needs how to answer the following question. What health programs need to be offered? Health programs are currently being offered in the community. What sort of them are they appropriate? And what are the major strengths and weaknesses of the system? But before assessment of availability and appropriateness of the services, a list of number of facilities should be established by type: hospital, health center, dispensary, health house, by operating authority, government, mission, other NGOs, private organization, donors, and by location. In line with the above, the planning team will have to decide which services programs are essential and important for an outpatient and inpatient department, and I show you by this table. Situational and outpatient care, antenatal, delivery, family planning services, general services, emergency care, EPI, growth monitoring, nutrition services, and inpatient care includes the general care, maternity care, pediatric care, surgical care, emergency care, and outpatient community-based services, home visiting through community health workers, EPI, domestic midwifery services, health education and promotion, and family planning. So you can see the coverage of health needs to existing healthcare programs. These are the different health needs. Available services programs, facility-based, you can see outreach, indoor and outdoor. Then there are different health needs: reduce anemia during pregnancy, family planning, improved decision making, improved referral and transport, prompt decision of services, increase maternal compliance. The given matrix lists the identified health needs and compares the service provision through the existing healthcare programs in the district to the health needs identified through the problems pre-need and pre-approach. The matrix is helpful in identifying the programs requiring strengthening to address the health needs and the areas where de novo interventions are required to solve the problem. Service input traditionally includes the 3 M's. Manpower, material goods, and money. Financial adequacy is assessed in terms of their availability, distribution, and functional capacity. Service inputs, the accessibility needs to be looked at. Physical accessibility, it should be within the 2 to 5 kilometers or alternatively 20 to 60 minute walking distance from the primary health facility with the relevant staff posted and available. Inpatient facilities with surgical, obstetric, and pediatric beds should be available. Financial accessibility should be there, and the social accessibility, like in terms of religious, tribal, and cultural barriers, institutional accessible availability of services. For example, in many other culturally conservative societies, female healthcare providers are essential for the provision of antenatal, natal, and postnatal care. So the assessment of management organization by the human resource management, financial resource management, physical resource management, support system, record information system, monitoring and supervision system, and communication system. Also transport system, repair and maintenance system, drug and contraceptive supply system, logistics support and referral system. Assessment of the service output. Health services must be sufficient in terms of quality and the quantity before they exert any beneficial effect. So to assess service output with respect to their quality, several indicators may be used. All indicators refer to the situation from either a recent health system review or from observation records collected in the preceding year. So the assessment of outcome parameters. The term outcome for planning purposes refers to intermediate results short of the final desired effects, the impact which have major influence on the impact. Service outcome parameters include the service outcome, which includes the preventive services, behavior and cognitive change outcomes, community-based, hospital and facility outcomes, curative and impact assessment by preventive and curative services. Assessment of community services, assessment of the effect of ecology, the environment ecology, that is social, cultural, demographic, economic, and political surroundings, embedding both the community and the healthcare delivery system, largely determine health problems, resource availability, interventions they are selected to address these. The planning team needs to assess and take into consideration main effects of the ecosystem. Geographic, for a district where difficult terrains, established communication and transport facility may be as important or even have priority over healthcare delivery issues. Social, if the majority of the population of districts are illiterate, it may be necessary to develop health education material that is mainly pictorial and easy to understand from looking at illustration. Existing material may have to be revised and adapted similarly. Cultural interventions may have to be developed that bypass or neutralize some harmful cultural practices. Among these are, for instance, the common practice of withholding milk or fluid from child while diarrhea, pregnant women starving themselves during pregnancy for fear of delivering too large of child, refusing immunization for false or superstitious reason, refusal by or lack of permission for women to be seen by a male healthcare practitioner. Political. What is the political status of the local government? Is it elected or nominated, centralized or devolved? How are resources allocated to health and redistributed between preventive and curative services? Identify weaknesses and strength of the health system. It is by SWOT analysis, which is strength, weaknesses, opportunities, and threat. And it is analysis, a useful analytical tool to qualitatively and quantitatively examine and assess a system, such as the district health system with respect to all of its individual system components. So this is a SWOT analysis of the hypothetical district health system. You can see the strength, components, the findings, then the weaknesses, then the opportunities, and these are the threats. All it is done, SWOT analysis is done by of anything. Then the review of resource availability, a preliminary process to assess resource availability that will assist in determining the scope of the district plan, the selection of the intervention strategies, and the objective of reviewing resource availability is to enable the planner to stay within the frame of realism and limits of available resources in the development of intervention packages. Resource availability are include the manpower in terms of number, cadre, gender, and quality of human resource, then the material, physical resource, including building, equipment, transport, drugs, and contraceptive, and dealing with the availability and functioning of these, and the money of financial resources to see the financial resources are allocated in terms of their distribution with respect to salary and non-salary, their release and utilization, and whether the facility in the government or non-government financed. These are the different types of healthcare financing by source of finance. You can see the source of finance is government subsidy, fee for service, user fee, community finance, shows social insurance, employee salaries and the insurance, and it is a method of collection, then the management, provision of care, benefits and risk and drawbacks. Developing intervention. It is a process of identifying, shortlisting and developing interventions measured from among a variety of potential interventions and its objectives to identify and develop the most appropriate interventions. This is you can see in the healthcare delivery system, there are the prioritized needs, then the resource availability, and leads to the developing the interventions. Select the appropriate intervention strategy to address the priority problem, adjust the existing services, establish additional services, and overcome constraints to effectively implement the appropriate interventions and strategies. If we see the 3-day model of the maternity, which is first delay in decision making, delay in reaching facility, and delay in health facility. It is the onset of the complication time passes to the discovery of the death. You can see the intervention metrics of high maternal death. The problem is there, interventions in the delay in decision making, we can inform, educate, and mobilize the family regarding danger sign from whom and where to obtain help. In reaching the facilities, we have to improve access to care, rational placement of all the facilities, and deliver with ensure ready availability of the staff 24 hours, trained staff, equipment should be there, or supplies should be available, and timely referral if it is required. Again, the priority health problems in a high mortality rate, health needs limitation to satisfy. And so you can see that identified health needs are the limitations and the suggestions of the interventions. Setting plan objectives and targets. Setting plan objectives is the process of defining what one wants to achieve sometimes or effort exactly within the planned period of time in light of early identified health needs, priority, and prevailing resource constraints. The objective is main objective, highlight which planner wish to achieve, quantify these, enable a focused selection of inputs. Determining plan objectives according to health status, service activity, management organization, support system, community involvement, and inter-multi-sectoral integration. Example is improve reproductive health services in Rajanpur. Long-term objectives of maternal mortality reduced to 340 to 3,000 in this year, and short-term objectives were all pregnant women in village of the district given advice and referred to antenatal services. So at the end, 80% of the women delivering in village of district are assisted by trained PBS. Setting targets. The target to reduce maternal mortality, it had been decided that midwives have to be trained and regularly monitored, and thus tetanus immunization, prenatal care, and emergency obstetric referral system should be provided. DHMT now has to determine all the following targets: number of midwives to be trained, number of training sessions to be held, number of tetanus injections to be given, number and frequency of prenatal visits, and percentage of obstetric complication to be seen in THQs and DHQs hospitals. So it is again the calculation of targets for two districts with different populations. It is a district one with the 5 lakh population is to distribute 30,000. So we all divide the EPI coverage, then decide EPI coverage. These are the objective. The ultimate target is to total children to be vaccinated. And again, you can see the difference according to the population, the number of facilities, and the number. Again, the developing the metrics for strategies and intervention for the problems of high maternal mortality. That is in this, the priority problem is improve obstetric care in villages and increase compliance, strategy interventions with the community-based obstetric care and refer to health facilities. Objective is all pregnant women in villages advised to refer to the antenatal clinic. 80% of women delivering in villages assisted by TBAs, and the indicator is percent of pregnant women registered in antenatal outcare registers, and the risk is that birth tenders may not accept training opportunities. So it is the strategy and intervention matrix. Target and activities matrix is same like the problem, the objective, then we set the target, activities, indicators, and risk. All these tables are all here, and you can read them by yourself. Then the matching targets of the performance. Planned service targets should be matched against expected potential performance standard using the available mix of resources. If the planned targets are higher than the potential number of services that can be delivered, giving available or potential sources, objectives needs to be modified to allow congruence between planned services and the potential performance level. Determination of resource requirement. Identifications of resource requirement is very important. Purpose is to, of this section is to identify the what extent existing sources cover planned intervention packages and what extent additional sources shall become necessary. So these are the resource requirement for immunization program of women against tetanus. You can see the activity, the personal physical infrastructure, equipment, drugs, transport, fronts. So you can see the different requirements. Adjustment, the management organization system is the coordinating center for all health service activity. The executive EDO heads it with the assistance of team of the district manager. The main purpose of MAO system is to ensure maximal efficiency and effectiveness of the healthcare delivery system. And one of the adjusting ML function activities is to, among several functions, the more important one address manpower, money, material, and the function of the support system in general. It is again the example. Support system include the monitoring and supervision, collection and analysis, reporting of the HMS data or health information system, ensuring a functional reference system, repair and maintenance, drugs and contraceptive supply. And its main function is coordinating different organizations or sectors. Coordination between different sectors, one of this very important function. Then the community mobilization. In what area, what activities should be community get involved with the involvement, with the improvement of delivery of healthcare, what actions are expected, but how may community involvement may be monitored, and what frequency, what are meetings with community representative to be held. Again, it is a management organization function required to improve maternal cares, tetanus immunization, assign responsibilities, and these are the different costs and the service delivery. Preparing the budget. Preparing the planned budget is a process of translating inputs, target activities into money. Purpose is identify overall financial requirement by plan period and individual year, identifying financial requirement by line time and the specific program, and enable performance and budgeting. You can see the budget line items of maternal mortality program. Line items are the salaries announced in non-salary budget, drugs and supplies, utilities, TAD, repair maintenance, contingencies, procurement, durable goods, and it is the total budget. Developing the plan of operation. The plan of operation is a written summary of the implementation plan, specifying sequences and timing of responsibility for implementation of main objectives, expected results, and activities. The purpose is to enable the plan implementing team to carry out all activities associated with the execution of district plan according to predetermined criteria of time, quality, and quantity. You can see the operation plan provides a set of guidelines dated running. Plan operation are divided targets and activities, and by the Gantt chart. Information and target and criteria, what is to be done, how to be done, by whom, when, where, means according to quality control measures, and it is done by Gantt chart. Information in Gantt chart, by whom, when, how often, what time period. So this is one of the example of the Gantt chart of the program activity. You can see on this side, y-axis is a train midfives. The different activities are given in this, and it is July, August, September, and in the horizontal axis is the time duration it is given. So it gives a bird eye views of the program and its time and it's going on. Planning and monitoring evaluation is a quality control mechanism and form part of the management organization because of its importance of the success health intervention is being elaborated in detail. The purpose is to run healthcare as efficient as effective as is possible within given ecological and resource constraints. All the activities which are given are given the Gantt chart, which gives the bird's eye view of the program, and second is the monitoring metrics. Monitoring metrics are for activities associated with the reduction of material. You can see the outputs, variables, tools of verification, reports, when and how to give back. It is all given in the monitoring metrics. So areas to be monitored: the support system, MMO system, health services input distribution, output. Planning for evaluation of the metrics associated with the reduction of maternal, short-term objectives, measurable variables, and means of variation. It is all done in this matrix. Recent updates. WHO country planning cycle database in Pakistan shows that the programmatic planning and project timelines, National Health Policy VN is 2016 to 2025. WHO country cooperation strategy was started in 2011 and finished in 2017. National Development Program started in 2007 and its deadline is 2030. USAID participant manual district health planning, Pakistan district health network projects. In this, Pakistan is a developing country and has been lagging behind many income countries in terms of health. The government of Pakistan is committed to supporting health for all philosophy as reflected in National Health Policy 2001. New management structures based on devolved administration and financial authority to the district government. The existence of strong district health team would definitely result in an effective service delivery system at district level. Capacity building is a prerequisite for a successful performance of health team. This training module on health planning has been developed taking the concept of WHO district health problem solving health planning approach, which has been adopted and modified. Now moving towards the MCQs. Government and NGOs of the country around the world are working together to maintain health system and health for worldwide. The process of thinking regarding the activities required to achieve a desired good in which of the following: funding, planning, criticizing, or evaluation?
B.
Anyone? Yes, planning is the correct answer. Number 2, the planning cycle is a systematic process which enables manager providers to determine how resources are used in relation to achieving their goals and objectives. Which of the following has the objective to ensure that planning process can be carried out smoothly in a planning cycle? Plan the planning, educational, situational, and political involvement.
A.
Yes, A is the correct answer. The situational analysis is the process of analyzing and interpreting all information available from the various sources on the current situation of the health system as it prevails within the specific geographic area under consideration. Which of its type helps in assessing the magnitude of the problem, which in turn helps in prioritizing the problem? Qualitative, quantitative, analytic, and descriptive. It is the descriptive is the one which tells the magnitude of the problem. A Gantt chart is a type of bar chart that illustrates a project schedule. It helps teams to plan work and properly allocate resources to maintain bird's eye view of project. It contains project tasks on vertical axis and horizontal axis. It presents perform tasks, time duration, name of organizer, pending tasks.
B.
B is the correct answer, time duration. One of 4 components which help in making the situational analysis poses problem prioritization. Important criteria used to prioritize the health and nutrition problems include all except magnitude, severity, political will, and personal preferences.
D.
Yes, B is the correct answer. The objective for reviewing resource availability is to enable the planner to stay within the frame of realism and limits of available resources in development of intervention packages. The resource availability include all except manpower, material, methodology, money.
C.
Yes. During COVID-19 pandemic, health planning team XYZ is responsible to review regarding availability of vaccines, vaccinated, supervise, and on daily basis updates of the data. The main purpose is to ensure maximal efficiency, effectiveness of healthcare delivery system. The task comes under the responsibility of each of the given boards: Development Intervention Board, Review Policy Board, Management Organization Board, and Finance and Budget. C is the correct answer, Management Organization Board. Monitoring evaluation as a quality control mechanism forms part of the management organization responsibility. The purpose of MAE is to render healthcare and as efficient, as effective as is possible when given ecological resource constraint. All other functions of MOE except whether objectives are accepted, results are achieved, identify that components of health system are in place and function, political involvement, and identify problems earlier to allow corrections.
C.
Yes, correct. SWOT analysis is useful analytical tool to quantify and examine and assess a system which, such as a district health system with respect to all of its individual system components. Which of the following is true about preparing a SWOT analysis? It should focus on where the organization is today, not where it could be in the future. SWOT analysis is objective. It should be specific and avoid gray areas. It should analyze the organization only and ignore the performance of competitors. C option is correct. It should be specific and avoid gray areas. The main purpose of MS system ensure maximum efficacy, effectiveness of the healthcare delivery system. It is functional management, which refers to the process of integrating of activities of different units of organization to achieve the organization goal. This is called operating, controlling, coordination, and planning. C is the correct answer, coordination, because the main purpose of management or organization system is the coordination between the different sectors. And so it is C. It is the key. And thank you.
Thank you very much, Dr. Sadia. I just have to ask you one question. Why you are so fast today? I have never heard you being so fast, and I was really wondering, perhaps I have to interrupt you in the middle of your presentation of being very fast. Then I realized that perhaps you have some shortage of time, or you have to attend some very important or urgent work. That is why you are so fast. Would you please let me know what happened today?
Actually, ma'am, my presentation was quite lengthy and I tried to finish it in a time because there were tables and everything was so important. I was unable to miss any of the slides in that. So I just wanted to give all the material to everyone so that everyone can read it at their ease. But I tried to finish it up within my allocated time as well. And I'm sorry for being so fast.
Right. I was thinking of perhaps we are going for redo, because there are many important points that have not even been elaborated, and it should be divided into